Let's get on to lots of your questions and considerations as you've been listening to the podcast over the last few weeks. Thank you so much for these. We really do appreciate them. Some of them we use week by week. Some of them we gather up like this to use in a special episode like this one. Right, shall we start with this email from Dr. Oliver Thomas in Edinburgh. He says, "Hello, Holyrood Sources. On a recent podcast, Andy Maciver made a powerful argument for why increasing capacity is the key to tackling the crisis in our NHS. Superficially, it's an appealing line. We have fewer hospital beds relative to comparable nations. We have chronic understaffing across the sector. Employ more people, build more hospitals, we can do more good stuff. This argument is simple, easy, and wrong. It's like managing an overflowing bath by buying more buckets. You need to turn off the tap. It isn't capacity that's the problem, it's demand. And demand is a much more painful nettle to grasp. We turn off the tap by placing far greater focus on prevention to reduce the pressures on the capacity we already have. And we need to have real discussions about the things we fund and the things we prioritise. We make decisions about priorities, both actively and passively, but don't always include the people most affected by those decisions, nor do we communicate those decisions honestly and openly. The NHS can do so much, but it can't do it all. More capacity may be part of the solution, but it's not the silver bullet," says Dr. Thomas. Andy Maciver.
I don't disagree. Actually, he will be pleased. Dr. Thomas will be pleased to hear that he and I are in the same club. We can get jackets made and go out and talk about it. Listen, when the thing is, when you're answering questions on the NHS, which I do quite a lot, and writing about the NHS, you can't always get everything covered at the same time. I agree with him that it isn't just about capacity. I think we have a capacity issue. The stats are very, very clear and obvious on that, which is that for the amount of money we spend, we have a very poor return in terms of capacity, and I include in that beds, hospitals, scanners, nurses, doctors, and doctors in training, which are also very low compared to other countries. So, I stand by that. The capacity issue, even if the NHS did less, which I think it should, I think he's right about that, the capacity issue would probably still be there. But fundamentally, he is correct. The NHS that we created in 70-odd years ago, which fundamentally is the same model that we have right now. It's the only unmodernised service in the country, really. Did far less. It did much, much less back then than it does now. Expectations of it were less, and the amount that it tried to do was much less. And there is no question that there needs to be a conversation here about what the NHS does and what the NHS doesn't do, what the state is responsible for and what the state is not responsible for. So I agree with him completely. We don't disagree at all. I think he probably just heard my capacity bit and reasonably thought that I meant that we should increase capacity and still do the same stuff. I don't. I think we should increase capacity, but we should also do less at the same time.
I'm not going to second guess the good doctor. He knows his stuff clearly, and actually it got me thinking when you were reading out that contribution that we do need to do a health special, but get clinical professionals on to tell us what the front line really looks like. I think two very quick observations. One, I think we need to be a healthier nation, and this isn't sexy for politicians because the preventative measures that you might put into making our country more active, for example, take one example, getting more sporting activity, more physical education, the benefits of that will not be felt for generations to come. But ultimately, I think that's something that we need to look at. I was a chairman of a sports charity which looked at how we can get greater participation in physical activity. I think that's got to be our focus. But I also mentioned in a recent podcast about my interactions with the NHS recently, and the doctor that said to me, the front line in the NHS in Scotland is like a Formula One team. It's just being run like it's a Quick Fit. No disrespect to Quick Fit, incidentally, because I got new tyres, by the way, last week from Quick Fit. And honestly, they did me a solid. I went in at 8:30 and I was out there by 9. Brilliant. No appointment. Well done. Quick Fit Aberdein. But the point he was making is that there was this bureaucracy above this that was hindering and being very costly. And so I think there's two things. We need to work out what things the NHS shouldn't be doing. I think we all agree there is too many things they're doing. And secondly, what politician is going to take this by the scruff of the neck and say we need to take a much more holistic, long-term view at preventative measures?
And the sad thing about the answer to that latter question is probably none.
Yeah.
Because a couple of the things that really, really need to be done are either politically toxic or they're boring. So the boring one is that we need to digitise the health service. The amount of money that is wasted in the health service, and obviously I know from my personal family experience here, the amount of money that is wasted in the health service because it is so outdated is extraordinary. I mean, it is eye-watering. This is a service that had, until recently, and possibly in some parts, still uses a fax machine, right? So this is what we're dealing with here. And so, you know, that needs to be dealt with. And that's the unsexy thing. But the politically toxic thing, of course, is that people in this country need to take more care for their own health. You know, we are an unhealthy nation, and a very great deal of it is down to the fact that people do not take responsibility for their own health because they know the NHS is sitting there to save them when they need it. Now, that's an awful argument for a politician to have to make, but it is the reality. And there's not many politicians who are actually prepared to stand up and do that, especially with a year to go before an election. So I ain't holding my breath on that one, I have to say.